Good morning, everyone. I hope you had a pleasant evening. I'd like to begin, as we do in Australia, by acknowledging the traditional custodians of the land on which we meet today, the Turrbal and the Yagara people of Mianjin. I pay my respects to elders past, present, and emerging. I also welcome all of our delegates from across the globe. There are over 90 countries represented here today. Thank you for attending FIP. Importantly, today is World Pharmacists Day, and I hope as you know, the theme is Pharmacists Strengthening Health Systems. And this is what you need to be wearing today. If you haven't got it, go to the FIP booth. Get one, get two, get three, put them on, wrists, ankles, anywhere you like. Today we celebrate our profession and we raise awareness about the role of pharmacists and their contribution to the healthcare system. We all know that pharmacy is critical for access to health, quality and safe medicines, and pharmaceutical services. We are versatile, we're agile, we're incredibly knowledge and skilled. And we will hear more about that today from our various speakers. But firstly, I'll do some logistics. So this is going to be the run for today. We'll have a short video presentation from our Federal Health Minister, the Honourable Mark Butler, who was unable to attend today. That'll be followed with a presentation by our President, Mr. Paul Sinclair AM, and Dr. Lars Ake Soderlund, who's our FIP Vice President. We'll then hear from the presidents of our two main pharmacy organisations, Dr. Faysim from the PSA and Mr. Tom Simpson from the SHPA. Then we'll get to have a panel discussion with our speakers, obviously minus the Health Minister. So just some logistics. We've used statements and declarations from the statements, and everyone's evaluated their conflicts of interest, and you'll get some notes around that as people speak. Please make sure you evaluate the session, and obviously if you've downloaded the app, you've got instructions by email how to download the app. Please reserve all the questions for this session's Q&A at the end. And we remind you no recording of session is allowed. This is being recorded and there'll be a live stream. No downloading of speakers' presentations, and again, that'll be available much later on. Feel free to shamelessly tweet and share today's session. Lots of at FIP Congress and at FIP 2023. Note, obviously take your belongings, don't leave anything behind. Visit the booth, pick up your band. And there are CPDs being offered by a number of organisations. If your organisation is listed here, you'll have your CPD allocated, so make sure you put that in. Okay, so I'm going to move on now to our Minister's presentation. Great. Can you guys play to the end? Thanks.
Well, hello and welcome to the 81st International Pharmaceutical Federation World Congress of Pharmacy and Pharmaceutical Sciences. Before I begin, I want to acknowledge the traditional custodians of the land on which the Congress is meeting, the Turrbal and Yagara peoples, and pay my respects to elders past, present and emerging. I extend that respect to other First Nations people at the Congress. I'm recording this on Ngunnawal country. In a matter of weeks, Australians will get a once-in-a-generation opportunity to change our country for the better. A good pharmacist listens carefully to their patients because a good pharmacist knows that when you listen, you get better outcomes. A wise parliament should also listen carefully to a group in our community who has lived with such poor outcomes and opportunities decade after decade. The valuable advice of an advisory voice of Aboriginal and Torres Strait Islander people is so clearly needed, but perhaps nowhere more so than in health. Year after year, our Parliament is presented with the annual Closing the Gap report, which lays out in just awful detail the gap in health outcomes between Indigenous Australians and the rest of the country. an 8-year life expectancy gap, 8 fewer years with loved ones, friends and family. With the best of intentions and substantial investment, things are just not changing. Indeed, in some areas, they're getting worse. The approach that governments of all political persuasions have followed over year after year is simply not working. We need the advice of a voice to Parliament, to the Health Minister and the Health Department, so we can find better, more effective, practical ways to close that gap and allow Aboriginal and Torres Strait Islanders to live longer, healthier, happier lives. As the Prime Minister has often said, if the advice is good, we'll follow it, and if it's not, we won't. It's a simple concept, but potentially just so powerful. But just as the benefits of voting yes are clear, so too are the consequences of voting no, because just as listening leads to a better diagnosis, if a pharmacist doesn't listen, it's pretty hard to get the right diagnosis and even harder to find the right treatment. Money spent on the wrong prescription is money wasted. So I urge all of you as health professionals to consider the positive impact that an advisory voice to Parliament could have between now and October 14. Can I acknowledge the new President of the International Pharmacy Federation, Mr. Paul Sinclair AM. Today is World Pharmacists Day, which is a time to reflect on the work of pharmacists and to thank you for everything you do as a vital part of strong health systems here in Australia, but around the world. There is often no more accessible place to go when people need health advice, when they need some support, than a local pharmacy. You put your patients first, and the Albanese government wants to help Australia's pharmacists offer more services to more Australians more of the time. We're living through very, very challenging times. The cost of living, ageing populations, pressures on doctors and emergency departments here and abroad. Making sure Australia optimises its health workforce across a stretched primary care sector will improve health access and equity across all communities, including, importantly, regional, rural and remote areas. We want all Australians to be able to access quality care no matter where they live. And to achieve that, we need pharmacists to play an even more central role in the health of Australians. Starting this year, the Unleashing the Potential of Our Health Workforce review will identify barriers and incentives for all health professionals, including pharmacists, to be better recognised, better supported and better utilised. The review will look at service gaps and the professionals who are skilled and experienced to fill those gaps. It will unlock the breadth of skills and a wealth of untapped expertise. Consultation has already opened, and I encourage all of you to provide your feedback. I expect the final report of the review to be delivered to the government in the middle of next year. In addition, the negotiations for an early 8th Community Pharmacy Agreement, or 8CPA, have already begun. The new agreement will support the government's ongoing commitment to improving patient health outcomes and providing cheaper medicines for all Australians. The Pharmacy Guild of Australia and the Pharmaceutical Society of Australia will continue to be signatories to any new agreement. In addition, consultations for 8CPA will include patient groups, medicines wholesalers and distributors, and others who have a stake in the growth and development of pharmacy services that benefit all Australians. A new agreement will also take note of past findings and recommendations of reviews into the sector. The government will look to harness all these lessons in developing a new agreement in partnership and through negotiation with the pharmacy sector. Look, I'll finish my remarks by saying that we want more people to benefit from the skills, training and experience of our wonderful pharmacists. Our world-class health system is stronger for your expertise and your compassionate care. Thank you for the work that you do, and I wish you all the best for the Congress.
Great. Thank you very much. So now I would like to invite to the stage our President, Mr. Paul Sinclair AM, as well as Dr. Lars Åke Söderlund, our Vice President.
Good morning, everyone, and happy World Pharmacists Day, a great day for our profession. I'm Paul Sinclair, the FIP President and I live in Sydney, Australia, and it's a real pleasure to welcome all of our overseas guests here at the FIP Congress. I'm joined by my colleague, Dr. Lars Acker Soderlund, the FIP Vice President and Co-Chair of the FIP Technology Advisory Group, and Lars is from Sweden. Today we are here to delve into the pivotal role of pharmacists in global health systems, especially in the context of the major global health initiatives that FIP led or contributed to. Let's begin.
Thank you, Paul. Can we have the slides on the screen? Thank you, Paul, and good morning, everyone. Welcome. As we mark the World Pharmacists Day 2023, we focus on the theme of pharmacists strengthening health systems. Pharmacists have been at the forefront, contributing significantly to universal health coverage, preventable health care, and patient care. And as we look forward, it becomes increasingly clear that pharmacists stand central in strengthening health systems globally. The journey towards improved health outcomes and system efficiency is paved with the opportunities and challenges, of course. And as we continue to invest in the pharmacy workforce in innovative delivery models, we also unlock tremendous potential to shape a healthier future for all. But even though pharmacists play a key role in improving health outcomes, like other healthcare professions, the pharmacy workforce faces challenges. These include a shortage of pharmacists in many countries of the world, differing education and training programs, including approaches to CPD, and the need for greater enhancement and continued development of professional roles and recognition. It is very important to note that pharmacy is central to achieving the United Nations 2030 Agenda on Sustainable Development. The UN recognizes the pharmacy workforce as essential to achieving Sustainable Development Goal 3, ensuring healthy lives and promote well-being for all at all ages.
Thank you, Lars. In line with this, FIP is committed to supporting the world to achieve the United Nations Sustainable Development Goals and universal health coverage. To enable our vision at FIP, we have made our global commitments to primary health care and universal health coverage for health systems very clear. Pharmacists who practice at the hearts of our world's communities make huge contributions to primary health care and health systems. To give some background, on the 21st of September 2020, FIP launched its development goals as a global framework to transform pharmacy. The development goals are a major global initiative for pharmacy to steer and focus our activities for the decade ahead. They build on the innovations that led to the launch of the FIP Pharmaceutical Workforce Development Goals in November 2016 at the FIP Global Conference on Pharmacy and Pharmaceutical Sciences Education in Nanjing, China. In turn, the PWDGs were inspired and adapted from the concepts underpinning the UN Sustainable Development Goals to ensure alignment of the pharmaceutical workforce to the wider global imperatives. For many years, the Federation has worked to advance our profession, driven by a vision of universal health access and coverage. At the WHO Global Conference on Primary Healthcare in Astana in 2018, a political commitment to strengthening primary healthcare was reinvigorated through the Astana Declaration on Primary Healthcare, to which FIP contributed, thus expressing the commitment of the world's pharmacists to the principles of this declaration.
Yes, indeed, Paul. Being at the Global Conference on Primary Healthcare in October 2018 in Astana, Kazakhstan, was a pivotal moment for FIP. And for many years, the Federation has worked to advance our profession, driven by a vision of universal health access and coverage. Our participation in Kazakhstan was the propellant for recent events that have indisputably raised the profile of pharmacy among United Nations agencies, national governments and their agencies, organizations in official relations with the WHO, and non-governmental organizations such as international professional associations and youth organizations. In Astana, a political commitment to strengthening primary health care was reinvigorated through the Astana Declaration on Primary Health Care, to which FIP contributed. This declaration actually will inform the United Nations General Assembly high-level meeting on universal health coverage on Monday. Clearly, pharmacists who participate and practice at the heart of the world's communities make huge contributions to primary health care every day. The Astana Declaration is another milestone that underscores the importance of primary health care globally. FIP has significantly committed to supporting this declaration, aligning many of our current policies to address the challenges highlighted in this pivotal document. FIP has not only endorsed the Astana Declaration, but also spearheaded various initiatives in accordance with our principles.
Exactly. And in addition to that, the 76th World Health Assembly, held in Geneva this year, also recognised the importance of primary health care as a resilient foundation for the universal health coverage, and agreed to prepare for a high-level meeting of the United Nations General Assembly on universal health coverage in 2024. The World Health Assembly 76 also adopted a resolution that urges member states to implement the Astana Declaration on Primary Health Care 2018 and to strengthen their health systems based on the principles of equity, solidarity, participation and multi-sectorial action. The 76th World Health Assembly served as a powerful platform where critical health matters were discussed at the global table. The FIP delegation played a significant role during this assembly, showcasing proactive engagement and delivering vital statements on various topics such as universal health coverage and health emergencies preparedness. The 76th World Health Assembly marked several milestones, including the adoption of a groundbreaking accord aimed at enhancing global preparedness and response to health emergencies. Additionally, a new program budget for 2024-25 was ratified, aligning the WHO's general program of work and reflecting the lessons we've gleaned from the COVID-19 pandemic. In addition to emergency preparedness, the Assembly also spotlighted other vital areas like women's, children's and adolescents' health, primary healthcare reinforcement, and addressed social determinants affecting health outcomes. We also saw an emphatic resolution on tackling non-communicable diseases and fostering mental health, particularly in the wake of the COVID-19 pandemic. Also, more tactically, FIP reinforced its collaboration with partners in past years. During the World Health Assembly in Geneva in 2019, we signed a Memorandum of Understanding with the WHO to support their initiatives in human resources for health, primary health care and universal health coverage. FIP's global roadmap serves to support our global commitments, the FIP strategic plan and our development goals for 2030. It provides a forward path in support of the UN 2030 Agenda on Sustainable Development and universal health coverage through pharmacy. The global roadmap is enabled by the FIP development goals and anchored within the FIP vision. The FIP Global Roadmap 2030 is available in both report form, but also a summarised web version on developmentgoals.fip.org/Global Roadmap 2030. The roadmap provides an overview of how we're aligned to the Global 2030 Agenda for Sustainable Development through our own FIP development goals, guiding principles that will underpin the work we will carry out during this decade and beyond. Strategic organisational enablers that support us in delivering this roadmap, and a set of milestones taking us to 2030. This global roadmap serves to support our global commitments, the FIP strategic plan and our development goals to 2030. It provides a forward path in support of the UN 2030 Agenda on Sustainable Development and universal health coverage through pharmacy. The global roadmap is enabled by the FIP development goals and anchored within the FIP vision, where a world where everyone benefits from access to safe, effective, quality and affordable medicines and pharmaceutical care. As we navigate this ever-changing landscape of global health, the role of strategic foresight cannot be understated. Our journey towards achieving the objectives outlined in the Global Roadmap 2030 is set to be a collaborative endeavour encompassing a range of initiatives and programs that pivot on ingenuity, resilience and unity. Today, I have the privilege of discussing the key enablers that will be central to this journey. These enablers will serve as the scaffolding that supports the intricate architecture of our vision. Let's delve into the strategic and organisational enablers that will pave the way.
Thank you, Paul. First, we have the FIP Global Pharmaceutical Observatory. This initiative aims to be the nucleus of global data, embodying the intricate realms of pharmacy, pharmaceutical education, workforce practice, and science. And by developing indicators and metrics that echo the dynamism and diversity of global health landscape, we aim to steer our initiatives with relevance and precision. And this observatory will be the beacon that lights our path, ensuring that every step we take is grounded in data and dedicated towards fulfilling the FIP development goals by 2030.
Building on that, our next pivotal pillar is the FIP platform for provision through partnerships. As we stand on the threshold of a new era, partnerships hold the key to unlocking unprecedented opportunities for pharmacy. Through this platform, we aspire to foster synergies that are tailored to address the professional development and educational needs of our vast and diverse workforce. This endeavour echoes our commitment to nurturing talents and fostering collaborations that span across pharmacists, pharmaceutical scientists, educators and pharmacy students.
Absolutely, Paul. And in tandem, the regional engagement and support programs stand as testament to our dedication towards nurturing an environment that is responsive and reflective of the diverse needs and priorities at both regional and global levels. And this engagement is not just about connecting, it's about understanding and adapting to the unique intricacies that define different healthcare landscapes. It's about crafting solutions that resonate on a personal level, yet have a global relevance.
Indeed, and to further augment our efforts, we introduced the FIP transformation programs. These are not just programs, but pathways that facilitate accelerated progress towards achieving the FIP development goals. By working hand in hand with our member organisations, we aspire to create a blueprint that resonates with both global and local health agendas, setting a precedent for collaborative progress. The nexus of these initiatives is the FIP Hub. We envision it as a focal point, a crucible, where the spheres of pharmaceutical practice, science, and workforce development merge, guided by the overarching mission of FIP. By the end of 2023, the FIP Hub will be instrumental in spearheading the ongoing development of the FIP development goals, ushering in a new era of collaborative innovation and progress.
And finally, none of this would be possible without adapting our ways of working. Our journey towards the future or forward is guided by collective decision-making spearheaded by the FIP Council, our foremost decision-making body. Our success lies in the synergy of our volunteers who fuel our structures and drive our vision forward, coupled with the unwavering commitment of our staff, who embody our professionalism and represent our collective aspirations. Together, we are forging a future that mirrors our commitment to health, equity, and innovation. A future where we all stand united, ready to usher in a new era of global health and well-being. And in conclusion, the path to the Global Roadmap 2030 is paved with dedication, innovation, and collaboration. And as we stand at this juncture, we are filled with a sense of anticipation and hope. Together we embark on this journey, united in our vision and fortified by our collective strength.
With all that said, the FIP Bureau Insights Board identified key imperatives and guiding principles that will underpin the work we will carry out during this decade and beyond. Without clear principles and imperatives, we will not achieve what we have all set out to achieve by that 2030 timeline. Let's take a look at them, Lars, very quickly.
Yes, Paul. The first one, navigating landscapes and rising demands facing the profession worldwide. Like all membership organizations, in order to thrive, we must adapt to the demanding challenges facing the profession worldwide, be responsive to scientific and technological advances, and understand how to advocate for and work around ever-changing policies and regulations. The next one, adapting leadership and focus through uncertain times to continue to steer, support, and represent the profession and our members. The global COVID-19 pandemic has taught us to learn to adapt to the circumstances that the world puts us in, not only as an organization, but as a whole profession. And FIP recognizes not only the importance of developing the profession, but also the complexity of balancing the delivery of present, emergent, and urgent needs with the future goals while trying to harness the opportunities presented from immediate difficulties. Understanding that sustainable development is not a one-size-fits-all model. FIP commits to supporting our members based on their needs, priorities, and capacities. FIP recognizes that there is no one-size-fits-all model, and sustainable development in one place, region, or country will not look the same in another. FIP will always support our members to adopt and adapt our tools and resources based on their local needs and priorities, and ensure that equity, access, and sustainability remain at the core of our mission. Strengthening global, regional, and national partnerships for transformation. We cannot do what we do without our partners and stakeholders. In addition to working with our members, our partnerships are essential to the profession's success and our own outreach, impact, and engagement. As such, FIP will continue to forge new memberships and partnerships and alliances and reinforce our existing ones. Supporting our members' implementation of the FIP development goals. Assessing needs, prioritizing, and implementing. FIP commits to supporting our members to implement the FIP development goals locally, regionally, and globally. Conceptually, goals provide organizations, professions, and end users with tangible, achievable, and purposeful scopes of work set against clear priorities. FIP is unique among pharmacy organizations because no other organization combines science, education, and practice under one federation that consolidates the position of pharmacists in different health systems and foster their ability to take on new roles and provide new services. All three of these domains of pharmacy are crucial. Practice can't exist without science or education or workforce development, and only this interdependency and alignment of these three domains can ensure universal health coverage. And last but not least, as the beloved Dominique Jordan would say, working together as one FIP, bringing together science, practice, and workforce and education under one umbrella.
Thank you, Lars. We envisage a global community where knowledge transcends borders and healthcare is a universal right and not a privilege. Through strategic alliances and global partnerships, the FIP aims to be the catalyst for this transformative journey. Thank you, everyone, our members, for being part of this global endeavour. Together, we will shape a future where health knows no boundaries.
Thank you, Paul. Together, with an eye on the global landscape, our strategies and plans are designed to foster a world where Healthcare is a shared responsibility and also shared success. I would like also to thank everyone for joining hands with FIP in this global mission, paving the way for a healthier, better connected world. And personally, I must say, I am extremely proud to be a member of FIP. It's such a progressive and dynamic global pharmaceutical federation with a huge amount of resources to cope with the global health challenges, making it possible to strengthen our health systems worldwide, leaving no one behind. Thank you and happy World Pharmacists Day.
Thank you very much, Paul and Lars Sake, for brilliant presentations this morning to start off our conference. Our next speaker is Dr. Fei Sim, who is an academic as well as a community pharmacist, but she's coming here in her capacity as the President of the Pharmaceutical Society of Australia. Please join me in welcoming Dr. Sim to the stage.
Good morning, all. May I please also start by acknowledging the traditional custodians of the land that we're meeting on today. This is the land of the Turrbal and Yagara people, and I pay my respects to the elders past and present. In the spirit of reconciliation, the Pharmaceutical Society of Australia acknowledges the traditional custodians of country across Australia and their connections to land, sea, and community. Can I please also send that acknowledgement and respect to all Aboriginal and Torres Strait Islander people here today in the room. Good morning, all pharmacists, and happy World Pharmacists Day. So who is the Pharmaceutical Society of Australia? Can I just say that I'm immensely proud to be the national president because we have some of the most amazing pharmacists here in Australia. And if I may add, I think pharmacists around the world are some of the most selfless people that I know. I'm biased, of course, I'm a pharmacist, but pharmacists are my people. So the Pharmaceutical Society of Australia, we represent all of the 36,000 pharmacists registered in Australia, practicing across practice settings. The majority of our pharmacists are practicing in community pharmacy, hospital, aged care, GP practices, in some of the Aboriginal health services, in industry, in academia, and so on. We know that pharmacists do amazing work every day, and we know that pharmacists are incredible in terms of contributing to the health landscape and the health system in Australia. For those of you who were there yesterday at the panel at the Australian Pharmacy in Australia, would know that yesterday we mentioned about our professional practice standards. The PSA is immensely proud that this year, in collaboration and in consultation with stakeholders in Australia, we launched the revised version of the professional practice standards. And why is that so important? Because we're really recognizing that there is a change in how we practice, and PSA strongly believes in quality and standard. And all the work that we do as pharmacists must be underpinned by standards and quality. For those of you who haven't had a chance to look at this, please visit our stand and we'll be happy to have further conversations with you. We're also immensely proud to be the custodians and the owner of the Australian Pharmaceutical Formulary Handbook, or the APF, which is the Bible for all pharmacists here in Australia. We also run our national flagship conference once a year in Sydney in the first week of August, so I do extend an invitation to everyone sitting here to join us next year at PSA 24 in Sydney in August. We also have our very proud journal called the Australian Pharmacist Journal, and our team of amazing staff usually works so hard around the clock to produce really amazing content for it. This is a statement that I'd like to share with my international pharmacist colleague. We strongly believe that we want every Australian to have access to the best healthcare and to enhance the lives of Australians through safe, quality, and effective use of medicines. We are committed to embedding, equipping, and enabling pharmacists to be at the forefront of healthcare, and we will continue to reflect on our contribution and our engagement with each other. We are stronger when we work together. This is the statement that we read out at every single one of our formal meetings at the start, to remind all of the attendees at the meeting about why and what we're doing and why we're here. We know that sometimes we might have some robust discussions, we might have differing views and opinions, but at the end of the day, we want to remember that we are stronger together and we must respect each other and create a safe space for everybody. And with that, can I please, on behalf of all of the Australian pharmacists, to welcome our international colleagues to the FIP Congress here this year in Brisbane. And can I please also say on behalf of Australian pharmacists how immensely proud we are, Paul, and congratulations to you, Paul, for being the first Australian holding this position as the FIP International, may I add, Pharmaceutical Federation President. And Paul, you have our full support. Now, we know that worldwide we have one major problem. We have an aging population. Specifically in Australia, the birth rates is between 1.1 to 1.3. And I know in many parts of the world, birth rates are well below the replacement rates of 2. So what does an aging population tell us? An aging population tells us that we can anticipate an increased demand in our health system and increased healthcare needs. But if we don't have more people, if we don't have more human resources to help the health and help improve the health systems of, and the health of all Australians and all people around the world, what can we do? Embedding and really embracing technology is one, but in Australia, we strongly believe that one of the key success to delivering a stronger health system is to enable all health professionals to practice to their full scope and top of scope. We know that that is a key. The other thing that we can also expect that comes with an aging population is the increased use of medicines. And for those of you who were there yesterday at my talk, I mentioned that when you have an aging population, you can expect increased healthcare needs, and you can also expect increased use of medicines. And we know that wherever medicines are used, there is an increased chance of medication misadventure. We know that pharmacists are medicine experts, and we know that wherever pharmacists are involved, we can reduce medication-related hospitalization by at least 50%. And that is an important statistic for us all to remember, and such an important piece for us when we do our advocacy work. Now, to maintain health system sustainability as a priority, I mentioned earlier we need innovation, we need technology, but we also need workforce capacity and capability building. And that is why at the PSA we strongly focus on standards, but also training and education, because we see that as part of our core role to upskill and to maintain up-to-date knowledge and to help pharmacists do this work really well. This is a slide that tells you what we were and what we are now. Change is not here yet, but in many countries, I would say that the change in pharmacy practice is imminent. And in Australia in particular, at the moment, we're facing some significant changes in health policy landscape. It is going to change the way we practice pharmacy. And if I may add, change sometimes can be unsettling, it can be unnerving, it can be nerve-wracking in many cases. But we need to embrace change because the work that we do as pharmacists should be here to serve a purpose. The change is driven by a health system needs and it's driven by the needs of patients. And for us, when we do advocacy work, everything that we advocate should come from the lens of the patients because what we do should be here to serve the health system. In the past, pharmacists have always held the role of the supplier for medicines. But we know that if we continue to treat medicine as a supply activity, medicine will continue to be treated as a commodity. But if we have pharmacist input, we have pharmacist cognitive and professional input into the supply, dispensing itself is a clinical activity. With pharmacists' involvement, we can turn a medicine from a commodity into a patient care service. Pharmacists now in Australia are considered as one of the key or the most important vaccination immunisation workforce. From the 1st of January next year, pharmacists across Australia will be administering all of the vaccines under the National Immunisation Program. During COVID-19, pharmacists stepped up and we administered one of the most number of vaccinations during the critical period. At the moment, pharmacists have actually across the country administered more than 11 million doses of COVID-19 vaccines. Pharmacists are going to be increasingly needed to use our cognitive input and our professional services skills from not just vaccination, but also management in a structured manner, common ailments, minor ailment screening, referral, triaging, management of chronic diseases, point-of-care testing, management of discharge services. All of these things should really empower pharmacists to allow us to use our skills to the top and full scope. So pharmacists around the world, whenever there's change, or whenever there's challenges, I should say, there are also opportunity, and it is time for us to embrace that opportunity. Health technology. Throughout these last 3 days around here, I've been hearing many pharmacists talking about what technology is going to do to pharmacists. We know that AI is already here, machine learning is already here. And sometimes, once again, that might cause some anxiety in us as human to say, what is that going to do to us? Is that going to replace what we do as a human pharmacist? But my message to pharmacists around the world is, love it, use it, and embrace it. The health system would always need pharmacists, will always need that human interaction, but if we embrace technology and help facilitate and improve efficiency in what we do, that will really help us in our role when we care for patients around the world. Back in 2018 and 2019, the Pharmaceutical Society of Australia recognises that there was that first wave or first need for a significant change in the way we practice pharmacists. And that was when the PSA set up on an agenda and released a policy document 5 years ago called The Pharmacist in 2023. That set the agenda for the PSA in our advocacy efforts, but it also helped guide Australian pharmacists as we navigate forward in the past 5 years. But little did we know that the pandemic was coming, and in Australia we were facing many, many episodes of natural disasters, from fires to flooding. And all of these natural disasters and the pandemic has really fast-tracked what the health system needs from pharmacists. I mentioned earlier that pharmacists in Australia now are one of the key primary healthcare providers for Australians. During COVID-19, pharmacists kept their doors opened, risked their own lives to care for the patients around their community. And I'm immensely proud of what pharmacists have managed to contribute during that time. But we also need to recognize that there is significant change, and we need to change and we need to evolve because we need to be able to do our best for our patients. And it is at this point in time, as we're winding towards the end of 2023, it is only timely for us to look at the 11 key action items that we set out 5 years ago as part of Pharmacists in 2023 to look at where we are at now. So if you are not aware of this document, I would highly encourage you to have a look. But it is also at this point in time that I'm very proud to announce that today, at World Pharmacists Day, we are launching the PSA's consultation paper for pharmacists in 2030. And we do highly encourage that all pharmacists to contribute towards this consultation paper and help guide and shape the future of pharmacy. At this point in time, may I please share one of my favorite childhood stories with the audience here today. And to my Australian colleagues and the Singaporean colleagues, if you can maybe close your ears because you may have heard this from me a few times, but I'm on an agenda to turn as many pharmacists globally as possible into a coffee bean. So once upon a time, there was a chef, and the chef brought out 3 pots and filled up all 3 pots with water. In the first pot, the chef put in a raw potato. In the second pot, the chef put in a raw egg. And in the third pot, the chef put in a bunch of coffee beans. The chef then proceeded to putting all 3 pots on the stove and turned on the fire and let it boil for 10 minutes. After 10 minutes, the chef turned off the fire and proceeded to look at what happened to those 3 things in the 3 pots. In the first pot, the raw potato went in to the hot water, hot and unrelenting. But after 10 minutes of boiling, the potato turned mushy and soft. But in the second pot with the raw egg went into the pot with a relatively hard and protective shell, but with a liquid center. But after 10 minutes of boiling, the egg became a hard-boiled egg. Just don't tell Gordon Ramsay that you've boiled the egg for 10 minutes. He won't be too pleased. And in the third pot with the coffee beans, after 10 minutes of boiling, the coffee bean turned into this aromatic drink that brought joy to people's lives. And if we take the boiling and the 10 minutes of boiling as adversity in our life, adversity in our career, we can't change what happens to us or around us, but we can change who we are and how we respond to that adversity. Don't be a potato, never settle to be an egg, and we should always strive to be that coffee bean. And spread this story and turn as many pharmacists as possible during such a critical time of change in our profession into that coffee bean. And I want to thank FIP as well for being the coffee pot, bringing all the coffee beans around the world together to form this beautiful pot of coffee. I do just have one last message, if I may. I'm accompanied here today by our CEO, Associate Professor Steve Morris, and the amazing team of PSA staff who work tirelessly behind the scene all the time. And I always say this, elected officials are usually on the stage, but the staff are the ones that work tirelessly around the clock behind the scenes. So I do want to say thank you on this very special day, as a very special thank you to the PSA staff. They are at the PSA stand if you want to talk to them as well. The PSA staff are the greatest asset of the PSA, so thank you to all the staff. And I also just wanted to say that if there was one thing that you can take away from this, my real key message today is to remember that pharmacist input is key to turning medicines from a commodity to a patient care service. We are clinicians, so think like a clinician, act like a clinician, because we are. And just finally, since we are in Australia and talking about animals all the time, this is a quokka, and you can only find quokka in Western Australia, where I live and where I call home. So please, on the way, if you're from Europe, Perth and Rottnest Island is on the way, kind of. So we will be welcoming you there if you're coming this way. And a special shout out as well to our amazing Peter Guthrie for the beautiful slides, the beautiful videos, and the recommendation to the food and drinks. So happy World Pharmacists Day to all, and I'll see you around today.
Thank you, Faye. I don't think I ever get tired of hearing the story about the potato, the egg, and the coffee. And a shout out to the AV team, because we were talking about coffee and how to make coffee earlier this morning, and they're doing a great job of making sure all of the AV is working and we're being live streamed. I like to think I'm coffee too, but anyway. Okay, for our final speaker in the morning, we have Mr. Tom Simpson, who's the president of our Society of Hospital Pharmacists of Australia. Like Faye, Tom and Faye are probably the furthest away in Australia in terms of travelling to Brisbane, but they don't have jet lag. So please welcome Mr. Tom Simpson to the stage.
Good
Or you can do clicker.
Could you pass the clicker to Kristen for here, please? I'm not much of a coffee drinker, but the thing I have in common with coffee beans is I am full of caffeine at any moment in time. Good morning, everyone. I'd like to begin today by acknowledging the Yagara and Turrbal people, traditional custodians of the land on which we gather, and pay my respects to their elders past and present, and I extend that respect to Aboriginal and Torres Strait Islander people here today. It is such a great honour to address you on this important day of celebration. World Pharmacists Day is a proud highlight of the FIP calendar and a day embraced by our profession here in Australia. This year's theme, Pharmacy Strengthening Health Systems, is a pertinent one, described by FIP as presenting opportunities to increase awareness of pharmacists as intelligent solutions. It's never been more important, has it? Amid the disruption of the past few years, and as many of our populations age, pharmacists have stood up and contributed more than ever, and yet our health systems face spiralling costs and growing burdens. We know we are an intelligent solution, and there is more we can do to ensure, one, that our ideas are valued and harnessed, and two, that we're recognised for what we can contribute. And I'll be covering each of these briefly this morning. Firstly, ideas. And intelligent solutions are at the heart of one of the key annual reports of the Society of Hospital Pharmacists of Australia. As SHPA President, it is my pleasure to announce the release of Pharmacy Forecast 2023 today. Now in its third year, Pharmacy Forecast Australia provides a window into our nation's pharmacy future. Pharmacy leaders drawn from every state and territory, covering regional and metro areas, and from hospital, government, community and academic backgrounds, have informed 35 recommendations grouped into key themes impacting our healthcare system. The forecast is a robust conversation starter, a strategic thought leadership piece on emerging trends and phenomena forecasted to impact pharmacy practice and the health of Australian patients through to 2028. However, the forecast is also a story of successful international friendship and collaboration. The seed was planted at a major meeting of the ASHP, the American Society of Health System Pharmacists, in 2019. ASHP initiated Pharmacy Forecast in 2013, and it's grown to represent an essential companion for strategic planning across the United States. Through Zoom conversations in the early months of COVID-19, we adapted the wisdom of crowds methodology for the Australian setting, and I would like to thank and acknowledge ASHP as joint copyright holders of Pharmacy Forecast Australia. This year, the wisdom of crowds sees survey respondents assess the likelihood of a particular scenario occurring in their local environment by 2028. The questions, responses and subsequent analysis and recommendations are once again divided into 6 themes. In Theme 1, the report explores the safe expansion of pharmacist-led prescribing roles and the agility and mobility to apply their specialist medicines expertise where it is needed most. The majority of panellists expect partnered prescribing roles to be standard of care in 2028, alongside more pharmacist-led hospital outpatient clinics and development pathways for pharmacy technicians. Theme 2 nods to our recovery from the worst of the COVID-19 pandemic, exploring trust between professions, between practitioner and patient, and the interconnectivity, security and respect that ensures safe and equitable care. 80% of respondents said that pharmacists would be near universally regarded as a trusted and reliable resource for health information by 2028. To get there, advice included proactively assessing trust with consumers within the workplace, including culturally safe practices, and considering trust in system and program design. Looking beyond our backyard, pharmacy system risks are analysed amid the realisation that disastrous, unforeseen black swan events now seem to be occurring at alarming frequency. Key recommendations here are probably more unique to Australia, to robustly review interventions to improve medicine supply and implement statewide services to coordinate responses to medication shortages, amid calls to overhaul planning and preparations in our natural disaster-prone country. On the technological front, Theme 4 makes an urgent call to ramp up planning now to ensure robust training is in place to maximise the benefits and minimise the risks associated with AI, machine learning, pharmacogenomic testing and 3D printed medicines. There was a lot of pessimism in Theme 4's responses, speaking to a wariness towards the current pace of change and unknown impacts on ethics and patient safety. In Theme 5, the forecast looks to the leadership and innovation required to ensure Australian pharmacy departments are operationally agile, informed by quality and timely data, and have the latitude to identify and upscale high-value care that delivers efficiency and better care outcomes. From operations, we flow into Theme 6 and discussions of funding, legislative, educational and cultural barriers and how they can be overcome to ensure hospital pharmacy continues to evolve and improve towards 2028. I would like to take this opportunity to thank the 120 pharmacists and technicians who contributed to this year's forecast. This year, for the first time, we presented a preview of our findings at our government at Parliament House in Canberra, a sign of the growing stature of this annual report. On Wednesday morning, I'll be taking a closer look at Pharmacy Forecast Australia 2023 and would welcome your questions on the forecast then. Now on to the second aspect of harnessing this year's World Pharmacists Day call to empower pharmacy to strengthen health systems. We need to be recognised for what we can contribute. Yesterday, it was my great honour to announce the formation of the Australian and New Zealand College of Advanced Pharmacy, or ANZCAP. The college is not a new initiative, but the culmination of years of planning and investment in structured and supported development pathways. This diagram shows growth in practitioner experience and expertise over the course of a career. The use of practice portfolios to track achievement against pharmacy competencies as evidence of this growth has been building for some time. While this is now embedded across most of our pharmacy schools and at pre-registration or intern level, it is overwhelmingly an activity that each person has to manage themselves. In 2017, SHPA took the first step towards changing this, introducing 2-year foundation residencies, pathways for career progression based on supervised and structured workplace training. In 2018, we launched advanced training residencies, which allow pharmacists to rapidly advance in their specialty area of practice over a subsequent 2-year period. Through these programs, evidence of achievement can be accrued in a planned, structured way, allowing pharmacists to focus more on what matters, improving their skills and patient outcomes. In support of these training pathways, SHPA's specialty practice has grown to span 33 networks of education, peer support and advocacy based on different pharmacy disciplines. So this was our development pathway until recently, which also reflects the tiers of SHPA's pharmacy education program. But there were 2 notable gaps. The pathways were not accessible to all practitioners, and pathways to advance and excel as a specialty generalist were not reflected, and it was too hospital-centric. What was needed was a broader program in which every pharmacist and technician can participate. It was this need to advance our profession as a whole that informed the founding of ANZCAP. When we go live on Wednesday, the 11th of October, ANZCAP will recognise prior professional experience through foundational membership, available until March 2024, which does not require the completion of a portfolio. For those who wish to enrol in our established structured training programs, these will be renamed as resident and registrar training programs. And these fast-track pathways will be expanded in early 2024 to recognise career progression and specialisation in the community pharmacy setting. Thirdly, and most importantly, the independent pathway, which can be undertaken by anyone at any time, regardless of where they work and what they do. Reflecting this greater inclusion, recognised specialties have also expanded to 40, including broader disease-specific options alongside medicines management, generalist, community pharmacy, and leadership and management specialties. It is important that pharmacy stands taller among our healthcare professionals. Through ANZCAP, the college, we have built a program in which every pharmacist and technician can participate. It is a program in which there are pathways to completely self-managed learning and development, or to follow suggested learning experiences and attain transferable recognition that is understood internationally. ANZCAP recognition provides a certificate and post-nominal structure that is agnostic of practice setting, which is important as we build the mobile and adaptable workforce of the future. The need for robust recognition is not unique to Australia, and I want to thank the representatives from many countries in attendance at this conference for your collaboration and advice. We have looked to you as to what has and hasn't worked across the world. And I would also like to thank the FIP leadership for their enthusiastic support for the college and its recognition system. Specifically, I would like to formally congratulate FIP President Professor Paul Sinclair and CEO Dr. Catherine Duggan, who have both been recognised as Foundation Fellows of ANZCAP. Particularly given today is about celebration, and I'll be inviting Paul and Catherine shortly to receive their certificates. Professor Paul Sinclair has been inducted as an ANZCAP Fellow with a recognised specialty of leadership and management. Dr. Catherine Duggan has likewise been inducted as an ANZCAP Fellow, also in the specialty of leadership and management. And I would like to acknowledge Catherine as a long-standing supporter of practice recognition in Australia, serving on the Advancing Practice Advisory Board from 2017 to 2020. This important group guided an earlier program that's informed the expansive and inclusive structure of ANZCAP. So, please join me in congratulating Paul and Catherine on their recognition as Fellows of the Australian and New Zealand College of Advanced Pharmacy. I'm also pleased to announce that, in the spirit of advancing practice everywhere, we are accepting expressions of interest from international FIP delegates to be recognised by ANZCAP in our foundation year. Full information, including details on the process, are available at the SHPA ANZCAP booth in the Expo Hall, where you can scan the QR code. Please look out for our wonderful logo, which the eagle-eyed among you may have noticed contains a nod to the mortar and pestle, a symbol of our great profession and shared history. Our aim is for Fellowship of the College to become a beacon for our patients and our profession, shining a light on the unique skills and experiences that practitioners bring in service of patient care and pharmacy development. The invitation to all FIP delegates aims to recognise the prestige in which our practitioners are held in any setting and specialty in which they practice. For now, thank you, good morning, and happy World Pharmacists Day.
Okay, great, everyone. We've got the panel discussion now. And so put on your thinking caps if you've got questions to ask. There'll be a roving mic. Just put your hand up, stand up, say who you are and where you're from, and you can pose a question to our panel. Now, whilst you're thinking, I'm going to start off with my first question to the panel. We spoke about it's World Pharmacists Day, strengthening healthcare systems. I'd like you to share your wisdom, knowledge, strategies around how the pharmacists on the ground can help towards strengthening our healthcare systems across the globe. What would be your advice? What can they do?
Can I start, please? Can I start? Well, first I would say what you have to do every year is to attend the FIP Congress. Because this is where you actually learn. We learn from each other. We share experiences. And people who have done, our colleagues all over the world who have done fantastic research can also shine while they present their findings. So for me, being at the Congress, it's about inspiration. And inspiration leads to innovation. So we can learn so much from each other and then adopt and adapt in our own home countries to strengthen our health systems.
Thank you, Lars. Who would like to go next? Paul?
Thank you, Presa. Look, I think if I had a message for every pharmacist, it is that we will need to adapt. How we've practiced in the past won't suit us or suffice in the future. And in adapting, I would suggest that we need to be the best pharmacists we can be. We should extend ourselves. We should embrace the notion of lifelong learning, because pharmacy is a very dynamic profession. Things change very quickly. We will hear presentations this week on digital transformation, other things which will affect the practice of pharmacy in all its forms, whether it be science, practice or education. So we need to continually challenge ourselves. We have unlimited potential as pharmacists, and a lot of that potential is very much untapped. We are a very, the term intelligent was used. We are an intelligent group of medicine experts, but we are an accessible and capable profession, and we need to be leveraged more aggressively so that the value we can add every day in our health system is realised. So be your best and strive to do more.
Faye?
Thank you, Presa. What a great question. I think every pharmacist can do two things. There are two levels of our contribution. The first level is our obligation to patients. So in your everyday practice as a pharmacist, do what you can to the best, for the best interest of a patient. But the second thing is to also recognize that every single one of us as individual, it is limited in terms of what we can do when it comes to advocacy, because nobody is going to advocate for us unless we advocate for ourselves. And that is why I think every single pharmacist, it is our responsibility to strengthen the professional societies or professional bodies in your country that represents your best interest. Every time when there is a health system change, you actually need a very strong body that has the representative power to be able to make representation. And the one thing that I repeatedly said is the thing that differentiates between us as pharmacists and any other professions or trade is our belonging to the society that represents you. So strengthen the society and be a member in your country's professional society, because when we are united, we can have a stronger voice.
Look, I think one of the challenges for the pharmacy workforce is we're an easy workforce to take for granted. And I think the more effectively we can own our own voice around what is the value that we bring. And being clear, medicine safety is one of the most important things we do, but it's also a consumer expectation. No one expects that a medication or a pharmacy service will be unsafe. So we've got to have a louder voice around the fact that actually medicines are more effective, medicines are safer, more effective, and actually a better investment in a patient's health outcomes when a pharmacist is integrated into that, not just the supply, but the use, review, prescribing processes as well. So a loud voice around the value proposition that we have that is unique to us.
Thank you. Lars?
Another comment? Yes, linked to the pandemic years we have experienced in the past, I think we now can see, or foresee at least, a very interesting journey towards 2030. And actually, the pandemic accelerated a lot of digitalization, digital health, and also new pharmacy services in a very short time period. And we can also see in many countries that clinical services now becoming a part of the primary healthcare portfolio of reimbursed services, making community pharmacy the gateway to care. But I think it's very important also to, as you said, to advocate for ourselves. And what I can see in many countries is that the regulatory bodies are lagging behind. The development is so fast, creating opportunities for pharmacy. But if the regulatory bodies don't actually realize it or change their legislation, we can't use these opportunities. And also another, I think, very important aspect is that pharmacy has to be part of a national health strategy where clear objectives, expected outcomes. In many countries, actually don't have a national health strategy. And some countries have, but pharmacy is not included. So I think that is very important for the future.
Great. Thank you very much. Are there any questions from the audience? Okay, Ariana. I can see Ariana in the corner. Sorry, guys, the lighting just is very strong, so put your hand up
Thanks very
high.
much. Thank you for a wonderful presentation and also for everything what you've been doing for years and years, producing beautiful leaflets about public health campaigns, inspiring many of us around the world. And thank you for that from Australia. What are your strategies or thinking how to stop moving pharmacists out of community pharmacy and clinical services these days? Are you facing the same problem in Australia? And how do you motivate people to stay, work with the patients? Because not always, as Lars has mentioned, the changes are quick, the changes are slow, and they feel burned out from waiting and being recognized. So we face lots of challenges in Europe. Young people don't want to stay in the pharmacy, they want to move out. So what do you do to keep them with patients? Thanks very much.
I love it when everybody just look at me and that I have the answer. Well, the great things don't, happen overnight. It happens from a series of, small efforts and collaborative efforts. And I must say that, in Australia, we constantly face challenges when we're advocating for advancing the role of pharmacist. I would say externally, whether it's with regulators or with other health professionals. And the message that I always have constantly is don't fight with pharmacists, fight for patients. So I think if we all come from the lens of being patient-centered and think about patient being at the center of attention, so whether it's regulatory bodies, whether it's other disciplines or other areas of practice within pharmacy or external to pharmacy, if we think about patient-centered and patient-directed care, it is about where patients would want to seek care. What is convenient for them? What do they want? Because once again, we must provide care through the lens of the patients that we're caring for. If that mode of delivery does not suit them for their own reason, then that's not the best care possible. So the reminder is always to think back at being patient-centered. And I'm always very disheartened when I hear people think primary care equals just GP, because it's not true. Primary care equals all primary healthcare providers. And we need a really good interprofessional collaboration on the ground. And I think the message that I always have every time we face any adversity when it comes to advocacy is just to bring back that patient lens and what our patient needs.
Paul, would you like to make a comment on that as well? From an Australian perspective and primary care practice?
Thank you, Parisa. And this is based on my Australian experience. But yesterday in the opening ceremony, I mentioned that governments and payers need to invest in our workforce. We need to realise the value of our workforce, and in particular our pharmacy workforce. Here in Australia, we have just had a situation where the process of supply of medicines has been devalued by increasing the number of days medicines that patients can receive on over 300 molecules. Governments don't see value in supply. Now that's a core part of what we do. And that is, and young pharmacists look at that and they see this industry is changing or this industry won't sustain me. But we have to encourage younger pharmacists to practice at their highest level. The future of pharmacy in Australia is not about supplying medicines. It's a big part of what we do every day, but the professional future is about patient care. It's about pharmaceutical care and disease state management. And if we are going to retain the best of our students in our profession, we have to offer them a well-paid pathway to be primary healthcare pharmacists who are delivering exceptional pharmaceutical care. So there is a change happening in Australia. The model that has sustained us for so long will not sustain us in the future. And if we are going to retain the very best of our graduates, we have to provide them a well-paid, professionally focused pathway which will guarantee them a professional life as pharmaceutical care specialists rather than pharmaceutical supply specialists.
Thank you very much. And you will have to, yeah, go on.
Look, I think it's a good question because I don't think it's a problem that we have solved in Australia yet. You'd have to look at the way that our health system works and say, if we're having 250,000 people present to hospital each year for medication misadventure, and every one of those patients got a medicine prescribed by a doctor and dispensed by a pharmacist, there's a missing piece there, and there is. It's the clinical input of the pharmacist in that patient's total journey, and I think that's where we need remuneration and our practice models to keep up. And I think further that, the issue of how we make sure that that it's rewarding for our professionals. I think it behoves all of us as pharmacy professionals developing the next generation to consider what it is that they need in their workplace. And there's I think a few things. First is to feel that they made a difference. We all got into this profession to make a difference to patients' lives. And in a community pharmacy in particular, you're in front of the patient. That is a beautiful moment to have with someone to make a difference to their lives, and we need to empower our pharmacists to do that. They also want to be respected by their professional peers, their interdisciplinary peers as well. And I know, some of the most rewarding experiences of my career have been when I've influenced another clinician's thinking from another discipline. And finally, I'll probably bang on my own point here, that they want to be recognised for the value that they bring. And if we can get those things right, and I don't pretend to have all the answers, I think we can come up with a way of better supporting our pharmacists in all practice, in all settings of practice.
Thank you very much. We've got a question there from the audience.
Good morning, everyone, and thank you for those inspiring speeches. It's Kay Dunkley here from Australia, from the Pharmacist Support Service. It's really exciting to see what's happening in pharmacy. As a pharmacist of 40 years, it's just wonderful to see where we're going, but we're going to need the workforce, and a component of ensuring that workforce is ensuring the well-being of the members of the profession. And while every individual has some responsibility for their own well-being, I'm interested to know what, as a profession, we can be doing, and particularly the professional organisations, to continue to support the well-being of every pharmacist so that we do have the workforce to take on all these new roles.
Who would like to take a crack of that one? Lars?
Well, I agree. It's a very important question, a very good question, and it's a reality in many parts of the world. I think you attended the Digital Pharmacy Summit, where we actually saw some examples from, I think it was the Film Institute of Sydney, how you actually can use the new technology to adapt to, I would say, dangerous or threatening situations in pharmacy, how to you can actually use it for educational purposes. That is one way of doing it. But of course, the workforce is very stressed in many parts of the world, and that is a problem. And it's also linked to what the previous question from Mariana, that people actually now are thinking, should I really study pharmacy? So, of course, that's a very important question, and we need to handle it. We had last year in Seville a session about mental stress and how to cope with mental stress as a pharmacist. It was highly appreciated, but I think we need to refocus on this area again, because it's growing and it's important. Because if we are not feeling well, we can't do our best as a pharmacist for the patients neither.
Thank you, Lars. Look, I would just commend the work that Kay does in the Pharmacist Support Service. For those of you who don't know about it, what she does is actually key to answering her question. And I would suggest that if you had the chance to talk to Kay, they run a service which is absolutely free of charge. It's anonymous, so to speak, because if I'm a pharmacist under pressure, experience mental health issues in the workplace or whatever, they support those pharmacists. So the support of our workforce is very important. As an employer, I was very conscious of the welfare of my employees, because they are my business, they're the interface with my patients. But I would certainly encourage any of the member organisations that are here, if you do have a chance to speak to Kay about the service they provide, I'm not sure if it is duplicated or replicated in other countries, but it is a very valuable service, and I would certainly commend the Pharmacist Support Service on the work they do, because the mental health in particular of our employees, both pharmacists, technicians and support staff, is critical to a healthy workplace. And we saw during COVID the pressures that everyone in our workforce in particular, because other primary health providers went to a digital model where they weren't face-to-face. Pharmacy stayed open at the coalface, and we paid a significant price for that. We lost a number of pharmacists. We have a number of pharmacists who left the industry because of the pressure they were put under. So as pharmacists, and certainly as member organisations, we do have a responsibility to our employees for their general well-being and their mental well-being, and it is something that we need to be acutely aware of. And if that service isn't available in your country, then I would certainly commend you having a look at the service provided here, because it is exceptional and is a real asset to our profession here in Australia.
Yes, I too would like to comment on the work of the of PSS and Kay, because speaking from first-hand experience, that is a very, very useful service here in Australia and has made some significant impact on some of our Australian pharmacists. I think pharmacists worldwide are still recovering from the burnt out from COVID-19, and yet, you know, in many parts of the world, including in Australia, we're now faced with another set of policy changes. So resilience is key, and I do want to remind everybody that we all have our ups and downs. Our emotional resilience can be up this month, but it can go down the next month. And we are it is on a spectrum in terms of emotional resilience. And it is exactly for that reason that we need to surround ourselves with very supportive group and friends and colleagues, because when we are on the down, be open to receiving help. That's one of the key things, because I know pharmacists, we always think about others, but we need to remind ourselves that it's okay to receive help as well. But when we're on the up, it is our obligation and responsibility to look after and lift the people around us. And yes, professional services, and also in addition to that, I do what Paul has mentioned. I do want to say that when you're on the up, volunteer for services like the PSS, because we all need to support each other.
Look, I guess there's the individual and the organisational level of looking at these issues of these workplace stresses. And at the individual level, you know, I have nothing further to say than just we need to empower people to be able to say, this isn't safe for me. And that translates to the organisational level. You know, resilience is key, and I think you know, I work in a public sector organisation where these kinds of organisations often roll out resilience training and things like that. I guess I'm somewhat cynical about that, and I think resilience isn't something you kind of get through a training package, and it actually puts the blame on the individual, and it says that if you fail, you weren't resilient enough, which I think is nonsense. I think what we need is workplaces that protect the individuals. Like Paul, as an employer, I see my responsibility to protect staff from unreasonable workloads. I want them turning up to work at 8:30 and leaving at 5. It doesn't matter what doesn't get done, because that's my problem, not theirs. It's one of the areas where I'm greatly assisted by SHPA's standards of practice, which outline pharmacist-to-bed ratios across basically every setting within a hospital. Those have recently been implemented in law effectively in the state of Victoria through their award, which I think is a really powerful step forward in saying we will, as an employer, make sure that your workload is allocated at a manageable level. Those standards are freely available through the Journal of Pharmacy Practice and Research for use by anyone.
Thank you very much. We have time for one more question from the audience. Catherine?
Not really a question, colleagues, but I'm always very, very enthused when I see colleagues bringing together ideas, sharing best practice. Just to note, colleagues, we've got an interprofessional working statement being approved by Council yesterday. So anyone in the audience who'd like to get involved with global policy on interprofessional working, please do so. Now, in the pandemic, we actually had to make decisions on the hoof quite quickly, nationally, regionally, and globally. I think, Lars, you make a point that the regulators really kind of helped us with that. They let us free a little bit. In Seville last year at FIP, we took a bold move to potentially call for action around things that emerged during the Congress. Knowing that we'd been through a pandemic, knowing that we had disasters, what could we do quickly? And I commend my Bureau and Council for allowing us to do speedy things speedily. Faye, you mentioned the coffee pot. FIP is a coffee pot for sharing best practice, for enabling colleagues to adopt and adapt, and also we have a commitment for universal pharmacy coverage to leave nobody behind. You mentioned about an ageing population in what we might call high-income countries. Other countries have different problems with demography, but we can share and showcase advocacy through evidence of impact, globally, regionally, and nationally. We can take a needs-based approach. And the big thing that I know Paul is building on Dominique's legacy is to leave no one behind. Countries that have need to share with countries that don't. We have an example of provision through partnership, and we have built a consortium of experts in quality assurance. So FIP doesn't do the QA, we're the coffee pot for those that have QA. What would the panel feel if I were to propose from the floor a call to action around bridging the gap, recognition, not provision model, but recognition model? Would there be an appetite for us to explore models around recognizing advancement, specialty, how that might support individuals in their growth on a global level? And could we start that so that we could think that countries that have resources and workforces could support those that don't, and we can speed up the mind the gap quicker? Would that be an exciting thing for us to explore? Thank you.
Do you want to go first?
You'll never get any disagreement from me about the need for collaboration across our boundaries. And of course, FIP's leadership of the advancing practice model has helped Australia and other countries around the world to implement practice recognition systems like the one we've described. Certainly, there's a great spirit of international collaboration here. The model that I described earlier in Australia uses the Australian competency and practice standards for recognition. In New Zealand, uses the New Zealand competency and practice standards. So I think there's a great appetite both in the region and the world for recognition writ large. And I think that that's perhaps the only way forward for our profession to stand taller and be able to paint a picture of the value proposition we have to government, to patients, to other disciplines, who we are and what we can do. I agree.
Catherine, I think you very eloquently articulated the gap that we have at the moment. So I can't agree more. And personally, I was born and raised in Malaysia. A special shout out to the fellow Malaysians here in the room today. I grew up in a developing country, and I consider myself lucky to study and to live and now work in Australia. And I've experienced health systems in many countries. And I must say that I feel personally a social responsibility, that we all carry that global responsibility to help lift the work that we do as pharmacists around the world.
Yeah, I can only echo the words of my colleagues here on the stage. And by sharing examples, by working together, united, we become stronger. And actually, I don't think we need to stand on our knees begging for recognition. We have so much evidence all over the world that we are the custodians of patient safety and working for improved outcomes. So now it's time to showcase it really for the politicians and the healthcare administrations. Let's go pharmacy.
Let's go pharmacy indeed, and I think we've spoken a lot about coffee, and I can feel that need for that coffee coming up. So in wrapping up, I'd like to thank you for hanging around for the plenary session. I'd like to thank our speakers for the great presentations. Please have a short break, and we'll see you back at whichever session you're going to at 11 o'clock. Thank you, everyone.